Because when we translate language without translating culture, we lose connection, trust, and impact. Today, we're talking about what happens when ABA crosses languages and why words alone aren't enough. Thanks everyone for joining us and welcome to Action Insights, the intersection between ABA and mental health. My name is Nikki Dione and this is my co-host.
Amelia Delphonse. And today we have a special guest with us. Andrea is a Spanish interpreter who specializes in translating ABA sessions. Welcome, Andrea or Andrea?
It doesn't matter to me, but Andrea, it's okay. I know you're talking about me, so or to me.
So why don't you tell us a little bit about your role and what you're currently doing?
I am a Spanish certified medical interpreter. I've been interpreting for about 7 years, over 7 years, for between ABA and early childhood intervention. I'm also a translator. Mostly my role would be supporting BCBAs during parent training sessions, in ABA, just being that cultural bridge, which I don't like the word bridge, but that basically that support, right? When you're trying to explain like this very specific ABA-ish concepts to your parents.
Yeah.
And
so we met through Facebook because I had put out there, I was organizing a course on parent training, and I wanted to get perspectives of what BCBAs were really struggling with. And you reached out because you had some really interesting thoughts that you felt you could share about your experiences in ABA parent training sessions. And it's interesting to me how there's you're like the third person in this, what's typically a two-person conversation. And so I think it's interesting you're almost like the fly on the wall that gets to observe all of those things that are happening in the ABA parent training session. And it's a difficult, one of the more difficult types of parent training sessions where the family, because they don't speak English, the family is clearly from another culture. And so there's often some cultural differences. Can you tell us a little bit about what some of those, maybe some of your more dramatic or memorable moments where the cultural differences kind of impacted the relationship or the interactions between the BCBA and the parents?
Oh boy, yeah. Something very specific comes to mind. So this, I was in a session where, so a little bit of cultural information in Spanish. And again, when we say Hispanic people or, Americans, this is very a broad generalization, right? Not everybody is going to be the same, but in general, always we say in general. In Spanish, we have this thing, parents have this little, it's an empty thread. That's what it is. It's when you're trying to teach a kid, don't do that. That's not acceptable. That's bad. So we'll say, you're gonna get pow pow. So pow is, if you look it up in the dictionary, basically is the sound of a slap, not a slap, spank,
Yeah.
right? I'm not saying I am going to spank you.
Yeah.
But I am trying to teach you, don't do that because it's wrong. And it comes out in the singy songy voice. We're gonna get pow pow if you do that. There is no intention behind that. Most of the times, right?
Yeah.
I was at a session and I'm interpreting, right? And the mom starts saying, get out of there. Te voy a dar. You're gonna get it. Pow pow. Pow pow. And the BCBA goes, what is she talking about? What is that? And I said, well, you have to ask the parent what that means, right? So she asked, and the mom says, oh, I explain what that means. And the BCBA immediately goes, you know, we like corporal punishment is never an option. She just went on this parent
Yeah.
as it's not acceptable that you say that you're going to spank your kid. And the mom is like, no, I'm not going to hit my kid. It's meaningless. Doesn't mean anything. But her face, her reaction, she was offended.
Mhm.
Because how would you say that I am going to hurt my kid? It doesn't mean anything what I'm saying. So in my head, I was like, oh no, don't do it. I know where you're going, don't do it. But that was, and I could see, the following sessions, there was a lack of, not trust, but it's like you are not going to understand
Yeah.
what we're dealing with. That doesn't mean anything. I'm not hurting my kid. I'm not going to hurt my kid. So in my head, I'm like, well, if you want to talk about why it's not okay to, use empty threats,
Mhm.
that's one thing, but don't necessarily just come out of the gate being like, what your culture, what you think that's just bad. We don't do that here. Like, no, she's not doing that here either. Nobody is hitting anybody.
Right.
So things like that I think, can really affect, the relationship between the
Yeah.
parent and the
Yeah.
BCBA.
I could see how that would put some walls up between for the parent and not them wanting to be more careful about what they say in front of the BCBA.
Yeah.
And when we're speaking with parents, we want them to be candid and open with us so that they're not feeling judged.
Yeah, and especially because it's like I said, it's this cultural meaningless
Yeah.
saying
Yeah.
that most of times doesn't have any effect on the kid. The kid is like, oh, you're gonna give me papa. I've seen kids saying pow pow, like the kids tell the mom, oh pow pow, I was bad, and nothing happens. It
Yeah.
doesn't mean anything.
It's interesting
So
because I've actually seen that with families, and I don't, I didn't take it too seriously because it was a family I didn't think and used corporal punishment, but I didn't fully dive into what it was meaning either. But now that you're talking about it, I'm like, oh, I've seen that.
yeah,
Yeah.
very
Kind of,
common.
yeah, it's an interesting kind of reminder too, or a really important reminder. As you're talking, I have like 8 million thoughts that always come in my head. So focus, Nikki. That the lens like through which we as providers look, right? So thinking about like, okay, I don't really understand what somebody means. Let me ask versus assuming through my own cultural lens or experience or where I live, thinking automatically that that is my interpretation, right? So like having this understanding that it's okay, as long as you're culturally aware to like maybe ask questions and not assume that we understand what is happening when there are, language differences, cultural differences. And then I'm also thinking about how challenging it must be for you sometimes to be sitting in sessions where inside you're like, no,
No.
like don't do it. But I think you were mentioning earlier before we recorded that, your job is to be there and like you're translating. You're not stopping sessions and being like, here's some advice. So like for you, I imagine that's so hard to sit and just watch, like to watch that relationship be impacted by that interpretation of the provider must be so hard.
Absolutely. And well, and you kind of have to, an interpreter's mind is, you're doing several things at the same time. You're listening what they're saying, you're writing notes, so you can remember, then like all these processes are happening in your head. And at the same time, you're evaluating yourself
Mhm.
in the situation because you cannot
Yeah.
not. And also, try to hold judgment as an interpreter that, hold judgment on the family, on, either party. But sometimes you have to like school yourself. Do
You're
not,
like, don't make mistakes.
do not, do not.
Yeah.
Have you ever had a session where you just felt like you really needed to laugh and you couldn't stop yourself?
Yes. And I did. And I was like, I am so sorry. And it was every time I think about that situation, I think it was just so funny. I had worked with this therapist before. So it wasn't like, oh, my first time with
Yeah.
them. And the child was funny. The parent, the whole situation, it was chaos. It was hilarious. And the question was, it was an evaluation. And the question was, is she gentle? Right? If you give it something delicate, can she be delicate, gentle with, something fragile? And the mom is like, no, she would just grab this doll and I just could picture this child doing this and being wild because while we were doing this evaluation, this kid was like up on the wall and looking up the way. She was everywhere. And I could see this kid being very, just swatting this doll and I just started laughing and I'm like, I'm sorry, I'm sorry. And when you try not to laugh,
Like makes it
Yeah.
worse.
it makes it worse. And I'm like, I'm sorry, I need 2 seconds. And I turn my camera off and then I just try to get it. And then I was like, okay, be serious. Be serious. But you're a person too, so you also have um your own emotions, your own regulation,
Yeah.
your own processes that you have to control to manage, right, during a session while everybody else is also dealing with whatever it is that they're dealing with.
What
Yeah.
are some examples of other phrases that don't translate well from English into Spanish or vice
Oh boy. Um, well, there are plenty, plenty, plenty. I always think specifically with ABA, for example, because ABA already has such a specific language, right? And what I think is very interesting is that in Spanish, so a lot of these concepts are that today we say, well, that's just a clinical language in Spanish, but they were translated. A lot of, you like the impact of English, medical English, um, in Spanish or, in the world, like a lot of words that we say, oh, just the way how we say it. No, it's not. We borrow that from English. We didn't have other words to use. Those terms didn't exist. And we decided, well, this is the best way to explain it. But a very simple example is manned. I always think about that word because in Spanish you have man in English. In Spanish is mando. That is the clinical terminology. That's a clinical term, mando. But in everyday Spanish, so a lot of these words that are formal ABA
versa.
have meaning in everyday Spanish. So if you're talking to somebody who doesn't know any of this ABA world, and you say things like that, it can get very confusing because like, what are you talking about? That's not what that is not what that word means.
Mhm.
Like, what are you saying?
Yep.
So mando, which is, the translation for man, um, there's another cultural saying, is when your parents call you, when or somebody older than you, we have formal and informal Spanish too, right? The way we address people that we know that we don't know changes.
Yep.
When your mom calls you and you're a child, even if you're older, and they say, Amelia, and you say Mande. Mande, and this is like a colonial saying. Like this comes from way back when. And what it really means is like, I'm here for you to command. Tell me what to do. But it's a sign of respect. Like you don't talk to your mom like you would talk to your friends. You are formal, the way you address your elderly. So you don't say what? You say, mande.
Yeah.
Mande, señor, mande, señora. It's a form of respect. So sometimes when you're interpreting, if I go immediately and I say, well, it's mando, it's a man, they're like, what? Like, that's not what I think
Yes.
Right.
Yeah.
when I think of. Another one is tact,
Mhm.
right? Because tact is labeling.
Mm.
Yep.
In Spanish, tacto, is touching.
Oh, yeah.
So
Yep.
you kind of have to go, yes, the word is tacto. It is correct. But you have to be aware that depends on who you're talking to, that's not going to work. And you have to think, well, this word means something else in everyday Spanish. And who am I talking to?
Right.
So things like that are to me are super interesting.
Yeah. And generally, we should be using non-clinical terms with parents anyways. But it just highlights part of why, it's more exaggerated when you're speaking to a different culture. But even in our culture, when we talk about mans, it comes from demand. And I mean, to a certain extent, yes, the child is demanding something, but it's really more of a request than an actual demand. So it's really interesting.
Right.
Did you have thoughts?
Yeah. And sorry, Nikki.
That's okay.
No, I'm just so listening. I'm just like loving this conversation so much. So please keep going.
No, I was also thinking about compliance. That's my
Mhm.
favorite. That's my favorite word because compliance, cumplimiento, right? In
Yes.
Spanish has a different meaning. When you talk about cumplimiento, when you talk about compliance in everyday Spanish, okay, it's more about corporate compliance,
Oh, wow.
right?
Yeah.
You can also say, so if you're talking to somebody, again, somebody who doesn't know anything about this, your parent that you just met, hey, let's talk about, let me teach you all this ABA stuff. And and sorry, yeah, so, and also cumplir, cumplimiento, it has a more formal, there is no direct translation. So what you want to say, what you mean for compliance in Spanish is obedience, obediencia, right? That's it. That's what it means. But English speakers, BCBAs, oh no, obedience. This is like blindly doing what I tell you. I'm like, no, there's no other way to say it.
Right. Mm.
That's what it means. And I think a lot of times it happens that um, somebody, BCBAs, will hear, or, whoever you're interpreting for the English speaker, will hear a couple words here and there and say, well, no, you're not interpreting correctly. That's not what I said. And I'm like, well, what you said doesn't make any sense in my language. Like, I can. I don't know. For the interpreter, it's a fine line between I can say exactly what you said,
Mhm.
and then we're gonna spend 4 hours here trying to untangle this.
Right. Or you
And
can translate the intent.
let me,
Yeah.
trust that I know what I know, because you probably, like, you should have interviewed me, that I knew what I was talking about, and let me help out with the communication.
Yeah. I think the point that just caught in my head too is that ability to meet with you before like sessions or like, right? Do you have that opportunity to do that where you meet with providers before you meet with them and the family, or is that not something that happens for you?
So for me, it happens
Yeah.
because I don't, I mean, you're hiring me directly, right? I'm not going through an agent. If you call a language line, you don't know who you're getting, right? You have to trust that they know. But I think it depends. I always say, if you need an interpreter, shop, buy local.
Yeah. I
Go
love
to the
that.
buy local. Go to the registry. Go to the certification registry. And look, an interpreter in my area, and spend 5 minutes talking to this person, and you will feel more comfortable.
Yeah.
Yeah. And a
I,
lot of insurance companies will cover the cost of an interpreter. So
Yeah, and I was thinking too, thank you for answering that, Andrea. I'm thinking way back to when I worked with a family who the child was hearing, but both parents were deaf, and we called the language bank. And the first, for my very first appointment, got who I got, and it was one of the I like think back, I'm like, that was one of the most epic fails of an intake that I have ever done in my entire life. Um, and finally, this poor kid who I didn't want to put in the place of translating said in the middle of session, "Where'd you get this interpreter?"
Hmm.
Right? Because they weren't translating or interpreting for the parents to be able to understand through sign language. They were like translating every single word that I was saying. And so I was lucky that I was able to find somebody that I met and talked to. And, it was just so helpful because I am a hearing person. I don't,
Yeah.
speak sign language. I live in my world. And it was so nice to meet with the interpreter, the new interpreter, before we went in. And I was like, I got to repair some stuff. Are there things that would be helpful for me to know? Tell me what I need to know about you. Like all of these things that I didn't learn in school. This was my first time having an interpreter ever. I
Yeah.
was like a baby clinician. I always joke that's what I was when I was brand new. And I, ever since then, anytime if I ever need an interpreter, I try and find somebody that I can, like you said, shop local, like find somebody who, is that I can meet with and get to know and, have as a support for all of us, right? We're all working together in my brain as a team. And there's such lovely continuity of care, I think, when I have the same person as long as
Mhm.
the family feels comfortable with the interpreter, interpreting and translating for every session, if that makes sense. Like for me anyway. And so I just appreciate you answering that. And
Yeah.
I'm just thinking back to that first time and I was like, what did I do? This was horrible, And luckily the family was so happy that we were able to find a good match. And, the interpreter I had was wonderful. And they worked with us for probably over a year, like for all sessions. I was like, I feel like we all know each other so well.
Yeah.
So, and that was
And
for mental health therapy. I was not a like a BCBA at the time, but I think there's just so much that crosses over, regardless of what service, right, medical service you're providing.
yeah, and I will always advocate for that because the interpreter, my role, particular, Andrea specifically, I cannot, there are bad interpreters out there. I've had family members who say, I don't want to use an interpreter. I'm like, why?
Yeah.
That's rude. Why? Because first of all, you don't know how much English the non-English speaker knows.
Right.
You
Yep.
really don't. So for me, I always try to at least 5 minutes before. Tell me, Nikki, you need an interpreter. Okay, what do I need to know before this session? Is there anything, or what topic are you covering? If because the more I can be prepared, what terminology you're going to use, I can be ready instead of you saying, some term and I'm like, wait, what? I have to look it up. I don't know what you're talking about. Um,
Google.
yes, it happens. But the interpreter, my role is not to make you feel left out
Mhm.
or make them feel left out. Is my job is to help you to communicate. That's it. That's why I'm there. So, and if we're working, together, if I'm your interpreter for all your clients or for this client or whatever the case is, um, I think of your interpreter as you think of the speech therapist.
Mhm.
It's just another person to collaborate with that has the same intention. My goal is that these parents understand what you want. I want them to understand. For me, particularly, it's very satisfying
Yeah.
when a parent, in their own way, oh yeah, I know what you mean, and I'm like, yes, they got it. They got it because I want them like as a non-English speaker. I know, and I mean I speak English, and sometimes I go to the doctor, and I'm like, I don't know what happened here.
Sometimes we go to a doctor and we don't know what happened. So
Yeah, and they're like, what kind of pain do you feel? I don't know. It hurts here. What do you mean? What kind of pain? It just hurts. So I cannot even imagine what it's like to be dealing with having a child with disabilities, with, all these things. I'm in a country where I don't speak the language. I don't know the system. And also like no. So I want to help
Yeah.
as much as I can. Everybody. I want you to be able to connect with your families, and that's gonna help your client.
So in your most successful sessions, what have you seen BCBAs do to make that successful?
They ask questions. Not I They ask questions, and I don't think this, and this is why. Okay, hold on. So what I mean by they ask questions is, okay, oh, this does this make sense to you? Yes. Okay. How does this work in your family? What are you thinking? Tell me what I just told you. As if I am not there. In my most successful sessions, I don't feel like I am there because it is not my job to make sure your family understood. It is your job. The way you would talk to, and rule number one when you're working with an interpreter is you speak directly to the client, to the family, not to the interpreter. Because if I wasn't there, what would you do?
We wouldn't be looking over here talking to no one. Like, like empty space over here, right?
Exactly. So we are supposed to be this non-intrusive figure. But in the best situations, in the best sessions I've had, it's that relationship. You and I are talking through this person, but I'm not talking to the interpreter. I'm talking to you. Okay, do you understand? Yes. What do you understand? Do you have any questions? What questions do you have? How does this look in your life? Like you would talk to anybody, any other client you have that also speaks English.
I like that question. How does this look? What does this look like in your life? Or how would this fit into your life? I think in general, even when we're not working with interpreters, that's a question that we fail to ask.
Or why not?
Mm-hmm.
Yeah. Why wouldn't this work for you?
Right. Those are good questions.
And I think it's a good reminder too. And, again, I think back to times where I've used interpreters and I'll be like, and I like kind of look and then I'm like, no, Nikki, you have to look like at the person because I'm not there to talk to the person who is there, supporting us communicating. And I think that from a respect and a connection perspective, doing that, I just love that you brought it up. Like I had a family one time who was like, the mom literally was like, I'm over here. And I was like, oh my gosh, thank you so much. I'm so sorry. I was like mortified inside. I was like, you're right. I apologize. And I, just work to repair in the moment. Because it's hard to to not look at a person, right? And like I'm not here for you, right? I'm here to connect with and work with and support the family that I'm working with. And I think it's such a good reminder, especially like in the context of like most successful sessions, right? Kind of look at speaking directly to the parent or the client or whomever you're working with. And I would ask anyone, how does this make sense to you? Does this, like, I'll say a lot, do you see this fitting into your day-to-day life, right? Like, is this doable is pretty much my question, right? Why wouldn't I ask that in the same, kind of context, regardless of who I'm talking to? So those are such great, things to remind us.
Yeah, and I think this is where remote interpreting has come to help
Mm.
because when you're in the room, they have all this theory about positioning the interpreter.
Right.
Well, I'm supposed to, in person, I'm supposed to sit like not next to the provider because then that signals an alliance, right? Two positions of power talking to this person who doesn't know. But then if you sit next to, it's like, I'm like, but why? But when you're remote, and I only work remote, right now, you two could be talking. You don't know at least that visual
Mm.
positioning, like where do I look? You're looking at the screen. There's no other way. And if you two are in person and I'm not, I'm on video or I'm on the phone, you look at each other.
Right.
Don't look at me. I'm your phone. I'm your, you are talking to each other.
I think that's really helpful information. We are just about out of time. So, what is one piece of advice that you hope that professionals, whether they be mental health professionals or ABA practitioners, what do you hope that they get from this?
Don't feel intimidated. Don't be intimidated because, oh, they're from a different culture. Oh, they speak this language. I don't speak that language. Talk to them the way you would talk to a person that understands your language, that somebody else that speaks English. Do the job of making sure this person understands. Can you have a bad interpreter? Yes, but you will know if you're asking questions, right? If you're, tell me what, get that feedback from your patient,
Mhm.
from your family, and then you will know what kind of information they receive.
Yeah, I
And
think
and
that,
I think a lot of all the other stuff will just come out as you get comfortable
yeah,
Yeah.
with this family. And we're not aliens. Oh, I mean, because you know, just ask questions. What does that mean? Oh, bow bow. What does that mean? Where does that come from? What's thing? Do you really use banking, or is it just? And I think you can answer your own questions.
yeah, yeah. Well, thank you so much. I appreciate you taking the time to chat with us. I think this is really interesting and it gave us a unique perspective. So it was great having you here.
No, my pleasure. Thank you guys nobody listens to the interpreter.
I mean, and I think I love this place. Like, why wouldn't we? Like, you have so much information. So I also want to second that. Thank you so much for taking the time and joining us today and sharing your wealth of knowledge and it was really lovely. So thank you.
Okay, absolutely my pleasure.